Modern life puts a lot of stress on our joints. Long hours sitting, repetitive workouts, and the natural wear and tear of aging. Over time, this leads to stiffness, inflammation, and pain that can limit how you move and even how you live. You might notice it when you wake up sore, or maybe an old knee injury flares up after a run. The truth is, your joints are under constant pressure, and once the cartilage wears down, it doesn't really grow back. You're looking at either living with the damage and pain, or the possibility of surgery. But what if there were ways to support your joints from the inside out, to help your body protect and prevent damage and stay strong for the long term? In this video, I'll show you some of the most effective research-backed supplements for joint health and injury prevention, and how they can support your longevity and performance. Stay tuned for more. Welcome to the channel, everyone. My name is Gary Carlson. I'm a health researcher with a full-time practice in musculoskeletal medicine, and I make health videos to help you live your best life. So, while supplements can't replace movement or good nutrition, they can enhance recovery, protect your cartilage, and keep you active longer. Let's start with one of the most trusted joint combinations out there, glucosamine and chondroitin. Glucosamine helps your body produce and repair cartilage, the smooth tissue that cushions your bones. Chondroitin helps that cartilage stay hydrated, flexible, and resilient under stress. And together, they've been shown in multiple studies to reduce pain and stiffness in people with joint wear and tear, especially in the knees. It's not an instant fix, but after 2 to 3 months of constant use, many people notice improved movement and less discomfort. If you lift weights, run, or do any repetitive sports, this combo can be a real long-term protector for your joints. Speaking of joint hydration, later in the video, we'll talk about a very important substance inside your joints that's been gaining attention lately, and it's often overlooked when discussing joint health. But next up is omega-3 fatty acids, one of the most powerful natural anti-inflammatory agents that you can take. Omega-3s work by blocking inflammatory molecules that damage cartilage and surrounding tissue. They also help with recovery, reducing joint tenderness after workouts or overuse. If you don't eat fatty fish regularly, taking a fish oil or algae-based supplement with at least 1,000 milligrams of EPA and DHA daily can make a noticeable difference. Now let's talk about a spice I've mentioned in a couple of other videos. It's also a potent antioxidant. It's turmeric, or more specifically, its active compound, curcumin. Curcumin helps regulate inflammation by blocking a major metabolic inflammatory pathway. And clinical trials have shown that curcumin can reduce joint pain as effectively as some over-the-counter pain relievers, without the stomach irritation. The secret, though, is absorption. Curcumin is poorly absorbed unless it's combined with black pepper extract or formulated for better bioavailability. So keep that in mind when choosing your supplement. Next up is MSM, or methylsulfonylmethane. It's a sulfur-based compound that supports collagen production and connective tissue repair. MSM not only helps rebuild tissue, but also reduces oxidative stress, making it both a recovery aid and an antioxidant. If you train hard or are healing from an injury, MSM can help reduce soreness and stiffness while speeding up recovery. Next up is a nutrient that supports both cartilage and bone. It's vitamin D, and especially when it's paired with calcium. Vitamin D helps your body absorb calcium and supports the strength and structure of your bones, which of course are the foundation of healthy joints. Low vitamin D is linked with higher rates of joint pain and injury, particularly in people who get little sun exposure. Taking 1,000 to 2,000 international units daily of vitamin D3 can help optimize these levels and enhance your musculoskeletal resilience. And speaking of vitamins, next on the list of joint support supplements is vitamin C. It supports joint health by being crucial for collagen production, which forms cartilage, tendons, and ligaments. For example, you may know about injuries such as an ACL tear in the knee. ACL in this case stands for the anterior cruciate ligament, which functions primarily to stop the tibia, that's your shin bone, from moving forward in relation to the femur or your thigh bone. But for our purposes today, the active word there is ligament. And as mentioned, vitamin C is necessary to build collagen, which is the main connective tissue that makes up your ligaments. So vitamin C works to keep your connective tissue structures healthy. It also acts as an antioxidant, of course, which helps fight inflammation associated with joint problems like arthritis. And unfortunately, many people don't get enough vitamin C, especially if their diet is high in processed foods instead of fresh fruit and vegetables. And finally, don't overlook magnesium. It plays a critical role in muscle function, helping prevent cramps and tightness that put extra stress on your joints. It also helps manage inflammation and maintain bone density, two key factors in long-term joint health and longevity. And most adults don't get enough magnesium, so a supplement of 200 to 400 milligrams of magnesium glycinate or citrate per day can make a noticeable difference in how your body feels and moves. Earlier in the video, I mentioned a substance that has a key role in joint health. It's called hyaluronic acid, and it acts as a lubricant and a shock absorber inside every joint in your body. And hyaluronic acid is relevant here because its production relies on magnesium and vitamin C. So that's another great reason to make sure you're getting enough of those two nutrients, especially because our production of hyaluronic acid declines as we age. So all put together, the supplements we've talked about today all work together synergistically, reducing inflammation, supporting cartilage, and strengthening your bones and connective tissue. They're not quick fixes, but over time, they help protect your joints and keep you active, flexible, and pain-free. Combine them with regular exercise, a healthy diet, and rest, and you're giving your body what it needs for longevity and resilience. Because when your joints move freely, you move freely, and that's the foundation of living well at any age. Thanks for watching, and be well.